On this episode of Africa Health Check.
Elimu itolewe kwamba hii chanjo ipoje. Tunapata habari nyingi za upotoshaji huku mitaani.
People need to be informed more about the vaccination stuff. But you know the local rumors that vaccines kill people, they are fake.
We discuss vaccine production in Africa.
We, ReVital Healthcare, at the peak of COVID, exported 1 out of every 10 syringes used globally for COVID-19 vaccinations.
And how the continent is building capacity towards manufacturing its own vaccines.
As of the end of 2022, Africa supplies less than 1% of its vaccine doses, despite being the second most populous continent and carrying 25% of the global disease burden. A reality check we got as a continent during the scourge of COVID-19 was when the vaccines were finally available, but just not yet available to African countries. We were desperate, we had to beg, we had to wait, and most importantly, learn a very important lesson the hard way. On today's episode, we will be discussing vaccine production in Africa. I am your host, Paladi Morokozo, and I welcome you to Africa Health Check. I'm joined by our experts, Dr. Marianne Morethi, the chair of the Department of Medical Microbiology and Immunology and a senior research fellow at the University of Nairobi in Kenya, as well as Reverend Anthony Achampong, who's a pharmacist and a pastor from Ghana. But before we get into that, let us have a look at this episode's feature story.
My name is Ronnie Kora. I'm one of the directors of ReVital Healthcare EP10 Limited. I'm also part of the End Malaria Council and Fund, which is part of Ministry of Health Kenya, and I'm also an advisor to the dean in a school in the US, Seattle State University. ReVital Healthcare started off in the year 2008, and when we established the industry, we had a vision in mind. The vision was to ensure that Africa as a continent is self-independent and self-reliant in manufacturing its own medical devices. So when we started off, we were only manufacturing one medical device, which is 2 types of syringes. And in a span of 15 years, we're now proud to announce that we're manufacturing over 300 products, exporting to more than 30 countries around the world, and having global certifications such as WHO PQS. We've got 9 products registered in the WHO PQS, being the largest WHO PQS holder in terms of certifications in Africa. During the peak of pandemic, the vaccine syringe that we're manufacturing, the 0.5 ml fixed dose vaccine syringe that we're manufacturing, prior to COVID, we were only doing 3 million pieces per month. When COVID came, our factory, the staff, the R&D team established that this particular syringe is going to be a massive shortage worldwide. So within 6 months, we increased the capacities from 3 million pieces to 30 million pieces in a span of 6 months. This enabled one of many factors. One of them, and being the most important factor, is to ensure that Africa as a continent has adequate capacity for syringe manufacturing. And that's what ReVital is always striving in. The biggest impact that we can provide is the job creation. Specifically within Kilifi County, we employ 650 people at ReVital. 80% are women, 99% of the workforce is all Kenyans. So it goes to show that we are in the avenue of creating jobs, specifically in a technical industry such as ReVital Healthcare. Part of the Bill and Melinda Gates Foundation grant that they gave us about 1.5 years ago, which we accepted the challenge to innovate a new technology which has never been seen before. So we're actually the first company in Africa out of 3 to 4 companies in the world which has come up with the innovation technology advanced syringe, which is the early activation 0.5 ml syringe. So through this, we've created a new line of jobs amounting to almost over 150 people. Now this is the less vulnerable people. So basically we hired mute and hearing impaired people. And we've started off with 150 people, all women. And we're gonna look to introduce new projects within Kenya, which are gonna increase capacities, more job creations to up to 1,000 people. And what we wanna see is having opportunities for the less vulnerable, because it's important. And having a technical industry such as ReVital Healthcare, giving an opportunity and a platform such as this, will showcase to the world that yes, it is possible. We have a lot of healthy youth population within our country. A lot of these youths come up with many innovative ideas, especially ideas related to healthcare. We have got telemedicine, which is a big practice happening right now. We have got new innovations in technology in terms of healthcare commodities. We need to unite research institutions, we need to unite licensed manufacturers, we need to unite government organizations, non-government organizations, and donor funders to make sure that we have a collaborative effort to start making sure that Africa as a continent is self-reliant. A healthy population is always a striving population.
Really powerful stuff there by ReVital, and I hope that if you're sitting at home watching this, you've also been challenged to do something about vaccine production in your sphere of influence. I'm going to just come back to the panelists right now. Maybe start with you, Dr. Marianne, because I know this is an area you're really passionate about. What is the current status of vaccine production in Africa? What has changed? Have we made any progress since COVID-19? Where are we?
Yes, and actually that's one of our dreams, to be able to be self-reliant. And I think we all remember 2020, 2021, we celebrated when vaccines for COVID-19 started getting rolled out. But then it quickly hit us that we were down the pecking order of getting these vaccines. And it took concerted efforts from various organizations to have us get those vaccines through donations, which again, we are very appreciative because it really saved lives. Yes. But then we had several problems. Some of these vaccines came when they were just about to expire. So what we do with them, we throw them away. And also on the negative part also, it made people really hesitant about vaccines. Why are they giving us vaccines like this? Is there something sinister going on? So really, it's a really good wake-up call that first we need to be self-reliant. Two, we need to build confidence with our communities. And it's fantastic to see ReVital, by our previous speakers, saying that they are starting to do something within the community of Kilifi. Yes. They are working with the people. They have started with the production of syringes. And it's just a matter of time where now they scale up and now maybe even start packaging vaccines, producing vaccines, gaining more confidence within the communities. And that's what we need within Africa, having plants, having concrete places where we are manufacturing these vaccines, trying this vaccine within our African continent. That way we'll not be talking about vaccine hesitancy because our populations already will be very confident on the production of these vaccines. They're being made here in Africa for the African people. And it's for us, then we can sell it to the world. I know there's been a lot of funding coming in and a lot of initiatives, and this has been taken up by the African CDC and various other organizations to have plants within Africa. Of course, there are several problems that we have to jump through. Who is our market? Yes, we produce. Our government's ready to order millions of doses for their populations. Do we have the resources to do that? So as much as we're talking about building the infrastructure, having the equipment, what is the end product? Who is the end person? Who is getting it? And who is buying it?
Absolutely. You were mentioning earlier on about, concerns regarding the quality of even the vaccines that we were receiving, because, in the past, there has been issues of Africa being sort of a dumping site in different sectors. Were these concerns, substantiated? Were they baseless, or did we have reason to actually be doubtful on whether we are receiving the right quality, the good quality of vaccines?
Yes, so one thing I would like to assure everybody, before vaccine is rolled out, it goes through several phases of trials. The first phase is it working? Two, okay, we noticed that it's building some immunity. Is it safe? Or is it going to come and wipe out the population? So all those tests are done. We have like 4 or 5 phases before it's actually rolled out. And the beauty also about this, all these phases, they're tried out in different populations. And by the time it gets to phase 3, meaning it's safe, it's immunogenic, meaning it's producing some immune response, it's protective. The next phase is to test these vaccines in populations populations that need it most. So, for example, malaria vaccine, by the time it reaches that phase, it will be rolled out in places that have malaria, they see malaria more. So to see if this vaccine is working within that population. So what am I trying to say? Vaccines are tried out also within the African setting.
Yes.
In Kenya, I'm involved in several clinical trials, and these clinical trials, we enroll children, we enroll women, we enroll men who are within the communities, and we are testing them and gaining a lot of confidence in these ventures. The COVID vaccine, the AstraZeneca vaccine, one of the population that it was tested on was in the Kilifi population here in Kenya, men and women. It was safe, it was efficacious, meaning it's working. And by the time now it was globally rolled out, it was actually well accepted within our population because they knew about it. They knew the benefits of it. So again, this is what I'm trying to emphasize, that we are a global community. So as much as they're being produced in the Western world, the production will happen there maybe because they have the equipment, they have the capacity to do it. But the testing, the trials are done in a collaborative partnership with both the Europeans, the Americans, and we in Africa. And I sit in several boards. I look at this data. I'm very, very careful to make sure that by the time we are presenting our information, it's safe. We've not noted any adverse effects. So we are very confident that this vaccine, once it's rolled out, is going to do what it's meant to be doing, and that is to build immunity, to protect you so that you can live longer and thrive within your community. So please, there's confidence by the time a vaccine is rolled out. It's safe, it's effective, and it will do what it's meant to do.
Thank you very much for that. And maybe just to bring you in, Reverend, here, what do you think have been the key fundamental lessons about domestic vaccine production that we've learned from COVID-19?
Yes, Africa has waited for too long for COVID to trigger this thing off, because the top 3 most transmissible diseases killing people in Africa: tuberculosis, malaria, HIV. There is a cry for vaccines to take care of these things, and it's long overdue. Thankfully, the CDC Africa is in collaboration with MasterCard Foundation, Save Lives and Livelihood, to do something about it, to go into manufacturing of vaccines. So if we are able to get our acts together with this vaccine production, it goes with training staff, training special skilled people in the area, building infrastructure, getting our governments to make policies, funding, and all those things to be able to kickstart this. Eventually, is to our benefit. They talk about we won't have market for it. And so what? If it is our priority, if it is our need, then we go for it. But for now, what I perceive and what I have known is that most of our governments, most of our nations in Africa haven't actually come with any concrete, definite policies towards vaccine production. You know, it tends to be talk. So once there are no definite agenda towards the manufacturing of vaccines, it becomes, it remains on the drawing board, and we keep on talking about it. So this platform is raising, and thankfully we have this eminent scholar in the area that believes that we can do it. Africa can do it.
Yeah, no, it's absolutely possible. I think I want us to comprehensively unpack this a bit. You know, we always talk about limited capacity, you know, not having sufficient capacity for us to locally produce, manufacture vaccines. But when we talk about insufficient capacity, what exactly are we talking about? Is it the research side, the development side, the technology side, the financial side? But when we say we lack capacity, Dr. Marianne, Reverend, what precisely are we referring to here? What's the capacity that we essentially are currently lacking?
Yes, so before that, even before I answer your question, I want to highlight Senegal. Senegal is actively producing vaccines, such as the yellow fever vaccine, and they've got it right. And for me, my dream is to see all of us really working together with Senegal, not just to produce one vaccine, but to produce the BCG for TB and several others, because already they have the infrastructure, they have the capability, but also not just in Senegal, would like to have all these plants all over Africa, because when we need the vaccine, we don't have to now wait for the population somewhere else to have it. We can just have it shipped within Africa. So we have the capability, we have the research scientists. It's a cry here of help in terms of we need to work together, both government, non-government organizations, donors, research scientists, and many other players to be able to work together so that we can have not just the infrastructure, not just the equipment, but also the technology. We have the mRNA technology that was developed in the US. Do you know this mRNA technology started many years ago when we were thinking of HIV vaccines? We are still looking for HIV vaccines, but it's because of that research we're able to quickly get the COVID vaccine because already the structure was in place. And we were participating, and we're still participating from the African continent, again with the manufacturers of the mRNA vaccine in the US. And right now there are discussions within Kenya, within Rwanda, to have the mRNA vaccine plans, and also South Africa.
Yes.
So the future is really bright because already the discussions are there. Funding is being solicited between government, donors, and many other people. And I believe next year, maybe when we sit here, we'll be talking about mRNA vaccine, possibly even for HIV, being tried and being rolled out within our continent. I'm very hopeful of that. But we need to have clear timelines, clear goals, something achievable in terms of what do we need to have in place, or maybe work backwards. We have the vaccine here. So what do we need to have this vaccine here? Do we need another plant? Do we need more people? If we need more people, are they being trained? Do we need to send them maybe to the Serum Institute in India that was also producing a lot of these vaccines? We need to send them for maybe a bit of capacity building or technology transfer, have them come back here. Again, as I keep saying, we are a global village. So we cannot just say Africa would just do it alone. No, we have to work together. But again, the future is bright. I'm very hopeful that soon we'll have several plants in all over Africa producing vaccines.
Psychologically, the pandemic has affected me through having fear. You have fear all the time that if somebody coughs, maybe it's the COVID-19. If somebody is sick, maybe it's COVID-19. If somebody has malaria, maybe it's COVID-19. If somebody has flu, maybe. So it's the fear. The fear of the pandemic is what has affected me psychologically.
I see the youth being involved in promoting better healthcare services by giving them an opportunity. Youth need to be given an opportunity. There should be active collaboration between adults and the youth, or decision makers and the youth, for the youth to be able to give real experiences about the things they go through.
Looking at the nature of the Africans, we have stronger immunity compared to the Western world, compared to other. If not, looking at our mindset, many people have died because of the pandemic. But from the observation, we found out that it doesn't affect the Africans compared to the whites.
Dr. Mary Ann, we're talking about what needs to happen, where the priorities should be, and the kind of collaborations or partnerships that we need to drive the agenda for domestic vaccine manufacturing. But I want us to sort of discuss the positive cases. What has been happening on the continent? I know several countries have been making positive strides in terms of improving, in terms of research and development, innovation, technology, to move towards domestic vaccine production. So maybe you can share some of those examples where positive strides have been made.
Indeed, there are several positive strides, and we're not just sitting ducks waiting for the next infection or the next pandemic.
Yeah.
A lot of work is going on behind the scene. I can give you a very exciting one for me, in my opinion, is what we see a lot in East Africa. It's called the Rift Valley fever. It's seen in animals and also it's seen in humans. And now there's a big effort to produce a single vaccine that can be used both in animals and in humans. And this vaccine is now going in phase 3, being done by KEMRI, Wellcome Trust, in collaboration with Oxford University. And the scientists involved are actually winning awards because it's very innovative to be able to have just this one vaccine that can cut across both the animals and humans. Now, we're not we're in that era of pandemic zoonosis where animals have almost the same infection as us, or there's that transmission. So that's a big effort, and I cannot wait for that vaccine to be rolled out. It's been done by Africans. I know the lead principal investigator is African, is Kenyan, but again, working in a global community. And again, this manufacturing is being done locally as well. So let's wait for that rollout of that vaccine. And there's several more coming up. Yellow fever, a vaccine again is being manufactured locally. Senegal is taking a big lead on that. And for me, what I'd also like to see, apart from all these infections we have vaccines for, is another neglected conversation, and that is snake bites. We have snake bites, and in Kenya, for example, we have to call South Africa to give us the antidote or the antibody or treatment for this snake bite. So what we're doing now, because now that vaccine or that treatment has to be put on a flight, come all the way to Kenya, that is 4-5 hours. So we have people losing their limbs, people dying. But now what is happening, we are now strengthening our infrastructure. We have this Institute of Primate Research in Nairobi, where they've now kept enough snakes. They're taking the venom and then producing the antivenom, which will be produced locally. And once it's produced locally, we hear in remote areas, a young boy, a young woman, or a lady was going to fetch water has been bitten by a snake. It's just a phone call away. It's available, it's local, and that will be able to save lives. So yes, there's vaccines, but there's also a whole docket of other interventions that these manufacturing plants can take up to. And believe you me, it will make such a huge difference, not just to humans, but also to animals. Yes, so we'll have very productive farmers, very productive humans, and the economy will thrive. And again, from our speaker today, a thriving community is essential to drive the economy, to drive up the GDP. So this is a wake-up call also for governments to strengthen this research institute, strengthen our farmers, strengthen the populations, the medical centers, so that we can have that thriving society.
Really, really incredible and absolutely promising. I think one of the things that I like so much you're saying is that, a lot is happening in Africa. We have more innovative, creative, energetic young people that come in.
So always no gloom and doom. There is nothing in Africa.
Exactly.
Let us forget about it, throw our hands in the air. When you hear stories like this, from Botswana, what Dr. Miriam said, I mean, it's quite promising. It makes you feel happy that so there is something in Africa. Exactly. So, and look at the feature story. That what is it? Reactive, that healthcare.
ReVital.
Yes. Giving jobs to people in the hundreds. So for those that are listening, there are foreign partners that want to come in to help this manufacturing thing, which we should all encourage and support. So a day will come, Africa, we are able to take care of ourselves.
Absolutely. I think it's actually a very important point, the commercial aspect of this, because, the Western countries are actually not just manufacturing vaccines just to save lives in their countries, but this is also a form of business. It's also commercial, because after that, you're able to take these vaccines, these syringes to other countries. So a lot of economic opportunities are also created in that. And this is, the pharmaceutical industry is a really big industry. And I believe that it's time that Africa is also a participant in that industry and not just a recipient, So I think one thing I love about a lot of the episodes that we're having for season 3 of Africa Health Check, we're actually featuring people who identify the public health challenge or problem in their communities. And the primary focus was for them to provide a solution. And then in turn, they started, a business out of that. So many of the stories, that's how they basically started solving a public health problem, and now they're running successful businesses. And I think that's also something that we can definitely adopt and take to every part of Africa. But before we end, I just wanted to just get your parting words in just a minute, Reverend.
The scare thing is funding. It's capital intensive. Where are we going to get the money? Who is going to sponsor it? I think where is a will, there will be a way.
Absolutely.
Besides, there can be collaboration, regional collaboration, when we're setting up this infrastructure for vaccine production. AU, the East African, West African communities can come together and say, hey, this is what we want to do. They have done it before in other areas. Why can't they transport it, into this noble task, noble venture?
Absolutely. Thank you very much. Your parting shot, Dr. Lane, in just a minute.
To add into what Reverend has said, apart from funding, we need our populations to be vast. Again, I go back to awareness. Do they know what a vaccine is? And why do we need the vaccine? So as much as we're talking about manufacturing, we should have on the other end of the scale, people advocating for
public
this
education.
Yes, because I don't want, again, a vaccine to be rolled out. We've done all this, but people are hesitant.
There's resistance.
There's resistance to it.
Yes, I think public education is a very important statement to end on, because like you're saying, we can produce manufacturers, but if our people are not aware of the benefits, the value, we're still going to have a problem of uptake and use of those vaccines. And that brings us to the end of today's show. But before we wrap up, I'd like us to take a look at our African health champion for this episode, all the way from Senegal. Very interesting, because we've been talking about how Senegal is doing really well in terms of vaccine production. Let's have a look.
Introducing Professor Tandaka Ndiaye from Senegal. With over a decade as a full professor at UCAD, his work spans immunology, vaccinology, and disease research. Heading key immunology platforms and the National Blood Transfusion Labs, he's a leading voice in HIV, TB, malaria, and Ebola studies. His roles at WHO and ASID reflect global impact, while managing vital vaccine trial drives us closer to eradicating diseases. Named to the WHO Regional Verification Committee, Professor Ndiaye's relentless dedication epitomizes Africa's health progress and makes him our Africa Health Champion.
And that brings us to the end of today's episode. From my awesome Africa Health Check team and I, we give you a big thank you for tuning in. Remember to subscribe, like, and share, and leave a comment on all our digital platforms so that you may form part of the stories that we highlight here. Follow us on Facebook, Twitter, YouTube, LinkedIn, and Instagram. The handle is @Africa Health Check. Until we meet again, same time, same place, same date, remember the future is Africa, the future is today.